Vail-Summit Orthopaedics serves one of the most active sports populations in the world, and with that comes a high number of meniscus injuries. Sports such as skiing, soccer, and tennis involve cutting and pivoting movements that strain the knee and increase the risk of meniscus damage. Dr. Rick Cunningham is a knee, shoulder, and sports medicine specialist with Vail-Summit Orthopaedics.
Most meniscus tears occur as a result of chronic wear and tear in the knee. They can occur with a traumatic injury, but 9 out of 10 times it's a result of just chronic wear and tear in a knee, the meniscus weakening and then tearing. Meniscus pain is very well localized. Usually you feel it on the inside of the knee where the medial meniscus is located, or the lateral side, the outside of the knee where the lateral meniscus is located. It's not a general ache throughout the knee like some other conditions. Normally patients with one finger or two fingers can point to exactly where the pain is emanating from.
The knee has both a medial or inner and lateral or outer meniscus. These rubbery, half-moon-shaped cartilages serve as shock absorbers between the femur or thigh bone and the tibia or shin bone. They protect all important articular or coating cartilage on the end of the femur and the end of the tibia, where these two bones meet to form the knee joint. They function by distributing the contact forces between the femur and tibia over a wider surface area.
It's critical to try to preserve and protect one's meniscus cartilage because that's the all-important shock absorber cartilage between the femur and the tibia. And if a large section is removed or if a large section tears, then more of the forces are concentrated across that coating cartilage surface, and then that area wears out prematurely. And then you hear of bone-on-bone arthritis. Well, that's where that articular cartilage has worn down to the bone on both surfaces and there's bone-on-bone contact. So it's critical to try to protect your meniscus from tearing, or if it does tear, in surgery, hopefully have it be repaired and preserved.
There are a number of options for meniscus repair depending on the age of the patient as well as the location and severity of the damage. Some tears can be sewn together with suture and will heal. Other tears are not repairable as they lack blood supply. In these cases, damaged and unstable portions of the meniscus are carefully removed.
Meniscus tears seldom heal themselves because they have poor blood supply. And so in most cases, in most adults who tear their meniscus, we're having to remove a small section of the meniscus. And I think it's critical in those cases to only remove what's torn and what's unstable and to preserve as much meniscus as possible. If a meniscus is torn in an area where there's blood supply, those are the types we can sew together and preserve the whole meniscus.
For patients over the age of 40, there's good news. Despite the fact that most meniscus tears in this age group are not repairable, most patients only need a very small flap of torn meniscus removed, and 90% are back to their regular activities at 1 month from surgery.
My advice to anyone who suspects that they tore their meniscus is to come on into the office and we'll examine their knee. It's pretty clear right from the get-go whether or not they've torn their meniscus or sustained some other type of damage, but it's not something that you want to let go. You should have it evaluated. If you do need surgery, it's about the simplest knee surgery that I do. It's all arthroscopic, and again, if it's just removing a small flap of torn meniscus, usually most patients are back to all their activities and feeling good at 1 month. I've undergone the same surgery myself, and I can say the same is true of me.